NBC30 Investigates goes inside the real ER tonight.
Every second matters in an emergency, but if you find yourself in an ER here in Connecticut, well, you better be prepared to wait. We're talking a long time, in some cases, several hours.
NBC30's Monica Buchanan takes a look at the reasons for the delays and the effect it could have on you.
I was getting severe head pain. The pain was the worst I've ever experienced in my entire life.
Terry Provost says a sudden headache landed her in the emergency room a year ago. But after she checked in, she says she waited 16 hours to see a neurologist.
They put me on a stretcher in the hallway, brightly lit hallway, all night long. And then the next day rolled around and they wound up admitting me into the hospital.
York Mario says a freak accident on his bicycle was so bad he was rushed to the emergency room by ambulance. Soon after he arrived, he says the rushing stopped.
And apparently I was on the gurney in the hospital for about 6 hours with road rash, a broken ACL joint, and a concussion. And nobody really was attending to my needs.
Both say they were in need of emergency care, but all they could do was wait. The latest study from the Cambridge Health Alliance shows they're not alone. It documents frightening treatment delays for all patients, especially those who are critically ill.
Sometimes instead of being in the waiting room for 4 hours, they're in a hall bed for an hour and a half or 2 hours or even 3 hours before they're seen. And that's hard on the patient.
A 2007 study by a healthcare research firm ranks Connecticut 35th worst in the nation for emergency room wait times. On average, Connecticut patients are waiting a little more than 4 hours. According to the study, it's right in line with the national average.
I think the main thing to blame is the aging of the population, sicker older people, multiple people in nursing homes who are sent to a hospital for an evaluation and treatment that they probably wouldn't want.
1 out of every 3 elderly patients that come to the emergency department, they likely will culminate in an admission.
Between 1993 and 2003, ER visits by people 65 and older increased 26%. That number is expected to double in the next 5 years, a situation the American College of Emergency Physicians has called catastrophic.
At any one point, there can be 5 or 6 people from nursing homes on stretchers waiting, coming in the door, waiting for the nurse to triage them.
Here at Hartford Hospital, doctors say ER wait times are better than they were 6 months ago, but
we're still not doing as well as we like. We still can have people who are relatively sick who can wait a couple hours to be seen. 60 miles away in Danbury, this hospital is also feeling the effects of an aging population.
This is not a new problem, but it's certainly getting a lot more attention now than it did 10, 15, 20 years ago.
Dr. Patrick Broderick heads up the emergency medicine department at Danbury Hospital. He says wait times here are considerably lower than the state and national average. The reason? A proactive plan to prevent backups by partnering with radiology, ER transport, lab services, and case management.
This is a hospital overcrowding situation. The ER just happens to be the entry point for patients where they will tend to the backlog or the rate limiting step or the gridlock will begin to occur.
Not only that, Broderick says hospital officials are also practicing bedside registration, which can cut wait times by almost an hour.
We've thrown a lot of resources at the arrival aspect of the patient so that your arrival is not hampered by the registration.
And if you think it's bad here, consider those living in Nevada and Utah who can expect to wait at least 6 hours in the ER. In 2004, the average wait time for a heart attack patient, 20 minutes. It was 8 minutes in 1997. And at least 5 of every 100 patients will leave the ER without seeing a doctor.
Everybody knows this is a problem, and the whole hospital is behind us. They empathize with us and they want it to be better. It's just there aren't always as many resources as anyone would like.
According to a recent survey, the #1 priority for America's emergency departments these days is improving communication to patients about delays. Not only that, many ERs are also making their waiting rooms more comfortable to compensate for the wait.
The days of kind of ignoring this issue are long gone.
So what's the bottom line?